Yay. 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 I grew up in the Bronx and always saw my sensitivity as a liability, something I needed to fight against. It was my war within. I was on medications for epilepsy from the time I was 8. That's me. Until I was 14. I just did that for that effect. No, that's not relevant to anything. No. But these medications slowed me down academically and athletically, and I developed this internal dialogue of what's wrong with me. And I saw myself as an easy target for bigger, tougher kids. And in the Bronx, toughness is really valued. And I saw myself as weak. And just see where I am. In 2007, I started working with a health coach. And prior to that, I'd say that I was coming from a scarcity mentality. Constant angst and anxiety of not enoughness. Not enough purpose, not enough money, not enough time, not enough energy, not tough enough. My inner tone was that of an inner bully. It's kind of like, what the hell is wrong with you? I was scared of that part of myself, but I saw it as just like who I am. I felt stuck with this war within. But when I started working with a health coach, all these opportunities started opening up because I had someone working with me on my beliefs and my attitudes. It's like that self-reflection every week and like seeing someone modeling it for me. And it changed everything. I developed this sense that I can have compassion for all parts of myself, including the part I couldn't stand, which is this inner bully. Even that part. That inner bully got me really far. That inner bully did a lot of good work. And so I now say to myself, more and more, I am becoming who I always wanted to be. And when it's really tough, it's, yes, love, whatever you need, love, I'm here. Love, first for you, and then for others. I replaced the limiting belief that I was weak with that I'm a heart warrior. I chose to be a heart warrior and passionately pursue what felt aligned and in service to my open heart. Today, I operate from the mentality that anything is truly possible. There is no limit to what I can be or what I can do, and I believe that for all of you. Thank you. So I'm going to share a presentation today that I'm really excited about, and it helps people connect to this mission personally and globally. And I'm going to give you access to this presentation so you can make it your own and share the message. I want to speak to a global health crisis today. Yes, our healthcare system is broken, but the problem isn't out there. It's in here. It's our mindset. We've been programmed to reach for the next pill for our health and our happiness. But true, effective management of our health is about education and care, and it gets unleashed with the power and through the power of habit change. So let me ask you a few meaningful questions. What is one thing you could be doing differently in your daily life that you're not doing today that would have a positive impact on your well-being? One thing you could be doing in your daily life that would have a positive impact on your well-being. Maybe it's eat better. Maybe it's sleep more. How many of you would like to get more exercise? If you followed through on this one thing for the next 90 days, how might it impact your life? How might it affect your outlook, your productivity, your sense of self, your relationships? If you had someone holding you accountable to this one thing to ensure that you integrated this one thing into your life over the next 90 days, would you have a better chance at doing it than going at it alone? So up until this time, most of us, though, have not had this type of dedicated support. And so we like to say, I should be able to do it on my own, right? If I just go to the gym or download that app or watch that workout kickboxing video I never seem to get to, then I'll be fine. And so we convince ourselves we're good. And so what's the impact of that reality? 70% of deaths globally, 7 out of 10, 70% of deaths globally are due to preventable chronic disease. There's around 1,000 people in this room. That's 700 of us dying, suffering, dying for something that we could all help each other prevent. We could all live into a future where that doesn't happen. It's the epidemic and pandemic of our times. And yet it's like, 7 out of 10. 45% of people in the U.S. have a chronic disease, and that's rising. That's an understatement. When you get into the autoimmune diseases, it's like we don't even know, because so much of it is undiagnosed. And it's not just the physical symptoms. It's the emotional and social needs that are not getting addressed. There's a New York Times excerpt by Tessa Miller chronicling her battles with Crohn's disease. And I just freaking loved her words, and so I'm gonna share them with you. It's hard to be a good employee when you need extended time off. It's hard to be a good friend when you cancel plans last minute. It's hard to be a good partner or parent when you barely have the energy to get out of bed. No matter how much you try to explain, people just expect you to get better already. And when you don't, they resent you, consciously or not. Some relationships end entirely, casualties of an unfair and misunderstood illness, while others get stronger as you find your true support system. But most of all, your relationship to yourself changes. You grieve a version of yourself that no longer exists, and a future version that is very different than what you planned. So that's the tough news. The good news is that we have a solution. The solution is to get people hooked on habit change. When you boil it down, habit change would prevent 80% of type 2 diabetes, 80% of heart disease and stroke, and 40% of cancer. The solution is simple, but getting people to change their habits often requires immersive coaching. The world needs a new kind of caregiver. A caregiver that provides ongoing support for sustainable habit change. A caregiver who inspires your intrinsic motivation. This kind of care is precisely what health coaches do, and all of us could benefit from one. By balancing all major life areas with clarity and accountability, my goal is to help you focus in on all the areas of your life that matter to you. See me as your secret wellness agent. If this type of work inspires you, my name is Eric Neuner, and I'd be happy to give you a free 20-minute coaching session to see if there's a right fit for you and to get clear on your next move. Thank you. So would having a copy of that be useful? Cool. Yay. So after this event, you'll be getting an email with a link to a copy of this presentation. Please. Yay. Yeah, just remember to share your personal story and make a connection with the audience in relation to your journey with health coaching. Or coaching, whatever it is, but that's the key. Right? You miss that, you're just talking at people. Okay. So I gave a version of this talk at the Catherine Dodd Wellness Center in San Francisco, and this in front of a group of healthcare leaders. And the center that I was at was named after a powerful woman in healthcare. She's a nurse. She was, I'm going to try to get all this. Here we go. She was the chief of staff for the Speaker of the House for many years. She was the deputy chief of Health and Human Services for, I'm not sure how long. She was the regional director of Health and Human Services, which is appointed by the President of the United States. She is now the chair of the National Committee to Preserve Medicare and Social Security. And she happened to be in the room when I gave this talk. And she decided to join the Become a Health Coach program. And she's here today, so wherever you are, Catherine Dodd, come on up. Yay. So good to have you. Such an honor. Thank you. Such an honor. So, with all your credentials, what had you choose our training?
I wrote my first diet book and exercise book when I was 7.
Wow.
I still have it. I just never followed it. And I've been on every diet, fad diet, medical diet that exists. And somehow, when you spoke, I realized that what I never had, I had lots of information, I knew calorie counts and carb counts, and you explained that I didn't need information, I needed habit change. And no one had ever, I'm 63, nobody had ever talked about habit change. Lots of do's and don'ts, but no habit change. So,
Wow.
here I am.
Amazing. And so, I mean, you have such a perspective on healthcare, the health system, policy. My goodness, thank you for all the wisdom you share with me. And so what has you excited about the future of health coaching?
I'm excited about the future of health coaching, but I'm more excited about the future of HCI because you have a larger mission than just helping individual people. I believe that health coaching makes sure that someone is in the corner of all those people who are trying to eliminate their chronic illness, but the larger mission is to heal ourselves and to heal the world.
Wow.
So we're all part of a revolution that's going to bring down healthcare costs, eliminate chronic illness and suffering, and really change the world.
Wow. Thank you. Thank you so much. Thank you. Catherine is working behind the scenes to really push this mission forward. She's making introductions. She's giving ideas, such big ideas, and it's all aligned with how to have us all thrive. And so I am so grateful to have this person, this heart warrior, as an ally. And so, Catherine, wherever you're sitting, thank you so much. You're an inspiration to me. This woman has more jobs. Thank you. She follows the heart. So I want to discuss 4 healthcare trends that are positioning health coaches to provide essential support. And the first is that the rate and the cost of chronic disease is rising rapidly. And so governments, institutions, insurance are all starting to pay for care innovations. And there's a lot to speak about here, but it's just care innovations that focus on lowering cost and patient outcomes. And so what this means for you is that the health coaches are essentially an essential bridge to resolve what is a care crisis right now. And I just want to speak to research and payment models are finally aligning because you can actually reverse chronic disease with the right lifestyle change and habit change. And that's now coming finally to the forefront of the conversation. And I wanted to speak to what just came out, which is Dr. Dean Ornish's new book called Undo It. And it's how simple changes can reverse most chronic diseases. And he's been at it, researching it for the last 40 years, and he got his lifestyle program covered by insurance and Medicare. And so, real pioneering work that he's doing. And his 4 tenets are eat well, move more, stress less, and love more. Right? And so it's like this 40 years of research lining up perfectly to exactly what health coaches provide. And so it's just the beginning. This is pioneering work, and aligning all the forces that be is work. And, the more we do our thing, the more we put it out into the world, the more people come into our life that help us. The second trend I want to speak to is that mental health issues and addiction is rapidly rising. And I want you to get that health coaching, this building of the intrinsic motivation for change, is a critical, vital step in overcoming anything. We're not going to break anything unless we actually want to change. No one can change for you. We don't do change for people. And so I just want you to value and honor the importance of this work. It's like we're all running over here, and we need to be running here. And I'm hoping that this synthesizing of this talk is like ammunition, it's collateral, it's fuel to just make this super clear for the world. Right? It's like there's an obviousness that I'm just like, hey, come on. I wrote that in. You know what it is? It's like this is the part where I was like, this could get really boring. I could talk about all sorts of stuff. And I'm keeping this macro because, look, there's endless research. I'm just telling you so much is happening at once. And so you just gotta follow your purpose, your interests, and go down that rabbit hole. I don't want to open up. I'm just the macro trends that matter, and then you find your way. This is a very decentralized system. If you think everybody's got it all figured out and it's some hierarchical, centralized thing, no, it's not. I've been playing in it. It's all over the map. And you get people who love everything about you, and people like, tell me about the evidence-based protocol, right? And so, but the range is all there. And so I just want you to don't give up the fight because of the naysayers. We know, intrinsically we know that human care matters. Otherwise you wouldn't be in this room. I wouldn't be talking to you. I wouldn't be growling, knowing it matters. So the third trend I wanted to speak of was our 65 plus population is rising dramatically. Our senior population is growing by 80% in the next 10 years. Combined with chronic disease, mental health rising, this combination and a caregiver shortage that exists and is only growing. Caregiver shortage of nurses, caregiver shortage of doctors, not caregiver overall. There's caregivers. There's care we could be providing the world. And so this system is being forced to change. And my intention, our mission, is to make health coaches what bridges that gap. Because we know, research proves that it will lower cost and improve patient outcomes. Never mind, let's keep people off this chronic disease thing. Let's get people hooked on habit change. Makes sense. And the fourth trend I want to speak of is that measuring adverse childhood experience will help us prioritize our future wellness initiatives and those who need the most support. And so we now have a tool, it's called Adverse Childhood Experience, it's called ACE, and we know that it's a predictor of future chronic disease and future addiction. And so this is spreading to corporations and governments, and I don't think they know what to do with it. But the reality is if you ask people a short amount of questions, you really could get on their map. And when you get on, when you know this about someone, then it says like, okay, care is needed here to prevent this next cataclysmic health event, whether that's addiction, whether that's chronic disease, or frankly, whether that's suicide. So we got a tool now. So let me tell you about a few exciting things about the company, about this mission, that are relevant to everyone here. And the first is empowered education, which has become our umbrella company. We know that what we have is not just something that you do for vocational purposes, but it's an effective ecosystem for learning vital life and health skills. Nutrition, habit change, personal growth. And imagine if when you were diagnosed with a chronic disease, instead of just being handed a prescription, you were given personalized health education, community support, and health coaching. Doesn't that make a lot more sense? So we decided to call this education platform Empowered Education. And we want to make empowered education and health coaching the norm. It's just how we do things. You could feel that, right? You just feel like, oh yeah, that makes sense. Like, oh. Right? That's it. Like when there is a transference, I really do believe this 100th monkey effect, if you ever want to. It's like when it's so obvious to us, then it's like it literally shifts the collective consciousness. Maybe that's woo-woo, but that's the intention I'm holding because it feels that obvious to me. And so to live into this big, bold mission, transforming healthcare, transforming chronic disease, we wanted a partner who had a framework for what healthcare could be. We wanted a bridge builder, someone willing to build alliances to maximize her impact. We wanted a nutrition practitioner who took on the most challenging cases. And someone who's just a bold, badass educator and well respected amongst top peers in the functional medicine movement. And we all agreed that perfect fit was Andrea Nakayama and the Functional Nutrition Alliance team. So they're on the team and it's freaking awesome. It's just this, there's so much positive momentum and perspective. And again, it's just like more heart warriors who know what they're doing, who know it matters. And so the third thing I want to mention was something that, again, behind the scenes, making it super search engine friendly, and now it's your turn, and it's called Health Coach Match. And Health Coach Match is our way of getting ranked in Google for when people are searching for health coaches and health and wellness transformation overall. And I got a big dreams for this of what it can become, and it needs you. Because the reality is, this is going to become relevant when we've got a bunch of active coaches with reviews and ratings and us certifying your training. And so on your student management platform, there's a link, Health Coach Match, and it's activate. And so activate your profile. And then my request is when you have a great moment with someone here, and there's a coaching moment, whatever it is, ask if they're open to a review. And let's get this. The key to this is it's got to have the feedback loop. All of this happened because of a feedback loop. And that's what we need for you. So that's what Health Coach Match is. It's your platform. It is my wish to make this thing. I did search engine optimization for a long time. I did it for early days of WebMD. I'm really excited to bring this. I think it's winnable. It's not a tomorrow thing, but it's winnable. And, we again, swing for the fences. And to make this big vision a reality, I'm really grateful, I'm proud. We raised recently $8 million with Rethink Education, which is a beautiful, impact-driven investor doing such good work in the world, betting on such good people and companies and community efforts. And they see what we believe, and they see the gap. And so I'm grateful to have their partnership, and I'm grateful to keep playing as big as possible, because frankly, that's what's needed. It's a $4 trillion problem. $4 trillion. When everybody being like, there ain't money for this. It's like, oh my God, goodness, there's not money not to do this. At least $1 trillion, 1/4 invested on our well-being, preventing the very thing that keeps growing. I mean, come on. So sorry, preaching to the choir, but I get lost. I guess what I wanted to share here is, like, you followed your heart, you bet on us, and I wanted to say you made the right bet. Okay. So what can you do with all this information and this rapid change? You know, here we're about preparing you for the future that doesn't exist yet, and we also see that you're part of building the future. So it's like this same thing of you don't know where one thing leads to the next, right? And so, but for us, it's about making you successful in the present. Right? Like super focused on fastest path to impact and income. And that's what we're all about here. And so with this, you know, all these changes, I just want you to know the wind is at your back. We're not going against. We're not swimming upstream. It's like people are really catching on. Dr. Dean Ornish's book, like these are big tide changes. They're big. He got Beyonce's endorsement, you know. So my question for you is, how big do you want to play? Everybody stand up. Take a deep breath. Close your eyes. Think back to the moment you decided to sign up with Health Coach Institute, or the moment you made the decision to come to this live event. Remember how it felt to choose what was true for your heart. What moved you? What were you feeling? Was it fun? Was it exciting? Connect with that part of you and bring up those feelings again. That is your inner heart warrior speaking to you. That is the part of you that knows you have something unique to offer the world. The part of you who sees and holds the highest vision for you. To learn, to grow, to empower yourself and others, to heal yourself and others. This part of you is courageous, wise, and strong. It's the part of you who knows when to say yes and when to say no. Your inner heart warrior is there to hold you through all the challenges, has your back through any obstacle, and reminds you that anything you do with love, with passion, you will be yesed for. See this inner heart warrior within you. What do they look like? What are they wearing? Notice their body posture. Notice the expression on their face as they look at you. And see your future. Now take a deep breath and allow that part of you to grow within you. Take another breath and feel it filling you, becoming as big as it can be. Allow your body to take the stance and the shape of this warrior within you. As you stand here in this room, as you feel into this energy of courage, strength, and purpose, I want you to complete the following affirmation in your mind. I am, fill in the blank. I am, fill in the blank. For me, it's I am willing. For you, it might be I am caring. I am unstoppable. I am fabulous. Take another breath. And now open your eyes and hold that stance. And turn to the person next to you, holding that heart warrior stance. And make a connection with this person with your eyes. I know, it's awkward. I know. You know, I didn't want to come up here anyway. It's awkward for me. So taking turns. If you could hear me, clap your hands. If you could hear me, clap your hands. If you could hear me, clap your hands. Now face the person next to you standing in your heart warrior stance and look them in the eye. And I want you to say to them, I am. And say it to each other like you mean it. One at a time. Clap your hands if you could hear me. Clap your hands if you could hear me. Ah! That inner heart warrior whispers. It whispers, but it's there, always. And so I want to feel your affirmation. So right now we're going to shout it to me. And what matters is that I see your inner heart warrior through how you share your affirmation. I am. 1, 2, 3. I am willing! We're going to do it again. 1, 2, 3. I am willing! Does your inner heart warrior feel seen and heard by you? We got to do it again. One more time. 1, 2, 3. I am willing! So feel the power in this room. Look around, this is us. This is an army of hearts. And this is the big one. This is your army of hearts. Breathe that in. Take that into your body, viscerally. We found each other. I really do want you to feel that in your body. The power, the energy, the potential. The world is at your fingertips. We're all here to support you and be supported. I'm not up here alone. I'm not alone. Neither are you. So it's up to all of us. It's up to you to decide how you want to contribute, to play, to give and receive gifts. When this army wins, the whole planet wins. So from this place, I want to make a declaration, which is I will. I will fill in the blank. And I will share mine, which is I will build a world where no heart is left behind. It's not about the how. What will you do? So take a moment, feel into that, breathe into that question. Keep standing. Hold into your inner heart warrior. Listen in. What is your true expression? What will you do? What does this inner heart warrior want you to do? Really breathe it into your belly. For you, it might be, I will heal compassionately, or I will serve passionately, or I'll be successful. Whatever it is, I'd love for you to sit down and write it down on your notebook. I am and I will. So as you go through the rest of this event, really hold this one in your heart. This is the place to bring it. This is the place to be bold. This is the place to experiment with you. Safe space, as they say. Yeah, this is it. This is the time. Don't miss out on being the person you were meant to be. Do it while you're here. You know, this is such an important reflection of who we are. It matters so much. And this song is called Aloha Keakua. And it's by Nako and Medicine for the People. And Aloha Keakua means all is love. And Aloha Kuleana means personal responsibility. Lend your ears, lend your hands, lend your movement, anything you can. Come to teach, come to be taught. Come in the likeness, in the image of God. 'Cause you could be like that, with all that humbleness and all that respect. All the power invested in me. Be it hard to love my enemies. All the black bags over the heads of the dead and dying. The more I understand about the human race, the less I comprehend about our purpose and place. And maybe if there was a clearer line, the curiosity would satisfy. Time-based prophecies have kept me from living in the moment. I am struggling to trust the divinity of all the gods and what the hell they have planned for us. I cry for the creatures who get left behind, but everything will change in the blink of an eye. And if you wish to survive, you will find the guide inside. If you know it, sing it with me. Aloha, aloha, ke akua, ke akua. Aloha, aloha, kuleana, kuleana. I go back and forth every single day. The clarity, it comes to me in a choppy way. As the feelings and the places and the seasons change, the galaxies remain. Energy fields comb the bodies of space. The angels that have come from a spiritual place. The hate that keeps me distant from a spiritual pace. Tenfold the mana when the planets are in place in polar alignment. We're on assignment, and our bodies on consignment. Return to the circus. And what is the purpose? What is the purpose? And would you believe it? Would you believe it if you knew what you were for? And how we became so informed, bodies of info, performing such miracles. I am a miracle made up of particles. And in this existence, I'll stay persistent, and I'll make a difference, and I will have lived it. Sing with me. Aloha, aloha, ke akua, ke akua. Aloha, aloha, kuleana, kuleana. Thank you. Thank you. Thank you. Thank you. Thank you. I love you. Thank you for being pioneers in this incredibly important work. I love you. Please make the most of this event.